Here we see the defect. An incision is being made around the defect, and then the limbs of the note flap will be created by making a line as a tangent approximately 1.5 times the length of the diameter. Here we see the lesion being excised. Once this lesion is removed, the other limbs of the note flap are drawn. There's the first limb. It's approximately 1.5 times the diameter at approximately as a tangent. And the second limb is now cut. That is the diameter of the lesion at approximately 60-degree angle. Now the dissection begins at the apex, at the 60-degree angle apex, and it is widely undermined so that the flap can be rotated into the circular defect to close that circular defect. We will have some excess tissue at the apex of the flap that needs to be trimmed. Now, the first suture is being placed, as we see in this example, from the apex of the flap, from the tangent of the circular defect. That's the point of maximal tension. The second suture is now placed. It's placed at the flap as it's being rotated into position. Notice this is a triangle being rotated into a circular defect. So we need to be able to trim the excess of that flap so as it fits and it will inset nicely into the circular defect. Here we see the dog ear. So we place a suture to close this end of the flap. Placing it in position, we can see the dog ear has now been created. We will remove that by making the back cut and then sewing that into position. Here we're now closing the remainder of the flap. You can see there's a triangular excess which will need to be trimmed and inset properly. And again, another suture is placed at the apex of the tissue so that all limbs of the defect are closed. The remainder of the tissues are closed according to the principles of halving. Now we can see that there is this excess. We now will cut this triangular excess off so that the flap will inset nicely into the region of the defect. This can be trimmed off with either a pair of scissors or with a 15 blade. And now the final stitch is put into position to close the wound, and the flap is now nicely in position, closing the defect. Here we have the dog ear. A hook is placed. The line of the back cut is marked. Always place the hook at the apex of the dog ear and always cut away from the flap. So you do not want to interfere with the blood supply. The back cut is now made. We can see using the hook that we have excess, and this excess is now trimmed off, removing the dog ear and allowing the flap to inset nicely into the area of the defect. This is a relatively fast and easy technique to remove the dog ear. And now the sutures, one or two may be placed depending upon the amount of tissue that needs to be closed. The sutures are now placed to complete the closure of the wound. Here we see the excision of the circular defect and the closure with the note flap.